Earlier this year, the Senate Health Committee brought in 3 drug company CEOs to question them about America's sky-high drug prices. One of those CEOs was Chris Berner from the company Bristol Myers Squibb. In a series of exchanges, senators exposed how BMS is abusing the patent system, forcing Americans to pay $7,100 for a drug that is available in the United Kingdom for $100. That drug is Eliquis.
And I would love the opportunity to bring down the price of Eliquis in the U.S.
Your original patent is well past expired, but you still are actively trying to prevent generics from coming to market.
It lowers the risks of strokes and blood clots, and it's one of the top-selling drugs in the world. The main patent on Eliquis was filed in 1999 and expired in December 2019. Now in Europe, competition entered just a few years after that main patent expired in 2022. In the hearing, senators asked why over 4 years after the primary patent on Eliquis expired, Americans still do not have access to a generic version. The reason is BMS gained the patent system by amassing dozens of additional patents that will keep competitors out of the market until at least between 2026 and 2031. In 2020, BMS used 2 of these patents to sue competitors from introducing a generic version of Eliquis into the market. In Europe, on the other hand, the UK Court of Appeal invalidated these 2 patents, whereas the USPTO granted them. Based on our findings, in the United States, BMS has filed 43 patent applications on the drug Eliquis, of which 22 have been granted as of 2022. BMS doesn't even have to assert all these patents in litigation to delay its competitors. Every patent that BMS has slows down its competitors because they have to expend resources trying to work around them and finding other ways to develop their generic versions. Then in the end, BMS can leverage these patents to extract settlements and sometimes even royalties from its competitors. This is a warped version of the US patent system, a system where branded drug makers regularly abuse it. Then they use marketing slogans such as "We value the power of science" to justify it. But what they really value is the power of the patents. It's a big step forward to see legislators scrutinizing drug companies' patent abuse. Now they need to fix the system that is keeping drug prices high and out of reach for many Americans. Our team at I-MAK explains how to do this in our latest blueprint.